Hello, everyone. This is Chapter 1, Drug Regulation, Actions and Responses. This is going to be the meats and potatoes of pharmacology, so we want to make sure we pay attention. Now, when we do the testing on this, remember there's a lot of biology in here. We're not doing biology. You already had that course. This is going to be more dealing with the drugs itself when we do the testing. Okay, but we do need to know the basics in order for us to get to the pharmacology stuff. So let's go back to the basics and let's talk about this. Pharmacology, surprise, surprise, the definition is study of drugs and their actions that happen to living creatures. So that's the definition of pharmacology. We're just going to go through a lot of the stuff. Now, the next thing we're going to talk about is drug and medications. Now, drug and medications, a lot of times people will interchange those two words. Some will say they're taking drugs, some will say they're taking medications. So you will hear them interchangeable. They are used a lot to treat health problems. They can actually stop, increase, or decrease things that are going on in the body. A lot of them do work on cellular levels in the body, so they do affect the cells. And they are beneficial if we use them correctly, but can be very harmful if we misuse them. So that's a bad thing. There are a lot of drugs out there that we do every day that we don't even consider are drugs. They're not prescribed, they're not illegal, but examples of those would be caffeine, nicotine, and alcohol. Those are all considered drugs, but we don't consider that because we do them on a daily basis. Drugs can be made from plants, chemicals. They can be made from products from humans or animals. For example, insulin. Insulin is can be manufactured in a lab. It can be taken from the pancreas of a cow or a pig, and then what we do is we inject it into a human, and it helps bring down blood sugar. Now, at this moment, there is no plant-based insulins out there. They have to come from the pancreas of some form of animal, and usually it's a cow or pig at the moment. So that's what drugs are usually made from. Now, drug therapy is how the doctor determines what medication they're going to go through, what they're going to pick for the individual. So it's kind of a step process that they have to go through to determine what's the appropriate medication, what drug therapy they should put this individual on. So drugs, it's a drug that will take care of the patient's certain health problem. Drug therapy is. The drug is picked, depends on the patient's need. And there's a process of picking it. Like I told you, and usually it is done by your PCP, which is your primary care physician or primary care provider. So you'll hear either two those terminologies, but PCP is what you're going to hear. So the first thing they're going to do is they're going to actually identify the health problem. What is going on with the patient? What do they need? So that's the identify the health problem. The second thing they're going to do is they're going to pick the drug that will have the best results without causing a lot of issues. So they're going to go through all the medications and see which one is going to be more appropriate for them. The third one is they're going to determine how are they going to give it. For example, are they going to give it intravenous, IV? Are they going to give it by mouth, PO? Are they going to give it intramuscular, IM? Are they going to give it sub-Q? Are they going to give it topical? Are they going to give it rectal, nasal, otic, buccal, sublingual, ophthalmic, vaginal, nasogastric tube, peg tube, gastric tube? So they're going to determine what route is the best to give it for this individual. The fourth thing they're going to look at is how much of the drug are we going to give? Are we going to give 500 milligrams, 1 tablet, 2 tablets, 1 suppository, 2 drops, 1 spray, 10 milliliters, 1 patch, 1 application, 1 dose? They're going to determine what is the appropriate amount of the drug they're going to give. And then they're going to ask what interval. Are we going to give it daily? Should we give it twice a day, 3 times a day, TID, every 8 hours, every other day, once a month, once a week? So that will determine that. And how long should they be on this medication? Is it going to be a one-time dose? Are we going to have to give it twice a day? Are we going to give it just once a day? Is it going to be once a month? Are they going to be on it for the rest of their lives? So those are what the doctor has to determine. And the fifth thing, what they have to do is which is the most important, is involve the patient with the plan. This is where they do a lot of the teaching to individuals about medications. This is where sometimes we have to even involve our family, but think about our clientele. If we work with the pediatric population, we have to deal with parents because kids are not going to be learning. If we're dealing with the Alzheimer patient, dementia patient, we have to involve family members because they're the ones that are going to be the primary individuals to be watching and making sure that the orders are taken, listened to. Anything that they need to work or watch on these medications, like for example, they need to follow up with blood work. People who are taking warfarin or Coumadin have to follow up and get an INR level. Also, they might have to check their blood glucose levels before they take the medication, like insulin. And some they have to check their vital signs. They may, like if you take an antihypertensive, maybe you need to take your heart rate, your blood pressure. People on digoxin need to take their heart rate before they take the medication. And also, if there's certain things that they can do, maybe they cannot take it with certain foods, maybe they have to take it at certain times of the day. So those are a lot of things that we're going to do last when we're talking about drug therapy. We want to make sure that the patient is able to understand when and where to take that patient. Now, each state has their own rules in regards to medication, who can prescribe, dispense, or give drugs. Depending on your facility, your state depends on what you're going to do. So who can actually prescribe drugs? Doctors and physicians can prescribe drugs. Advanced practice nurses, such as nurse practitioners, CRNAs, certified registered nurse anesthetists, they are the ones that can prescribe medications. Dentists, podiatrists, your PAs, which are physician assistants, and veterinarians. Those are the individuals who can prescribe drugs. Now the pharmacists do not prescribe drugs, but they do mix and prepare and dispense medications prescribed by a physician or an advanced practice nurse, etc. They also teach, and they are the biggest help to nurses. We utilize them in regards to a lot of questions that we have when we're dealing with certain drugs. So they are very helpful with that. Now your pharmacy techs, on the other hand, pharmacy techs will mix and dispense the medication, but only under the guidance of the pharmacist. Okay, so we do have pharmacy techs. Now medical assistants. There are medical assistants out there that can administer meds, but under supervision of a prescriber or a licensed medical professional. And it depends on your state and your medical facility that you work for. Now the nurse's role, that's going to be the most important role of all. This is where we are the ones to administer the prescribed medication as per ordered. It is important, that's why it's very important to know what the drug is, know what the purpose of the drug is, the actions, the side effects, problems that can occur, our delivery method, and the follow-up care that goes up with it. We are the ones that do the major educating when it deals with drugs. We are the patient's advocate. We are the ones that if we see something, we need to report it. If something isn't right, we are the ones that need to make sure the doctor knows, because we're the ones that are dealing with the patients more than the physicians. So the nurse's role is the most important role. So those are some of the different things of the different roles of the different providers and all that. So now we're going to talk about intrinsic drugs. Intrinsic drugs, those are the ones that we make on our own. Those are the meds that are inside our body. They're made inside our body, and they are usually like hormones, enzymes, growth factors. Our pancreas makes its own insulin. Any substance that can change a cell's body, and it's all internally made. Now, extrinsic. That is what we are learning about in pharmacology. These are the drugs that we take into our body that will change an action on a cell or an organ. So we are actually taking it in. We're taking it from the external and bringing it inside to us. So they're extrinsic, coming from the outside. Now, a lot of these we're going to talk about, remember we talked about the drug cards. These are what we're going to be dealing with the intended action or therapeutic response. This is when a medication is prescribed that the med will have at least one desired effect. Okay, for example, amlodipine, which is Norvasc, it is prescribed for hypertension. The intended action of the drug is to dilate blood vessels, which will decrease the workload of the heart, which in turn will decrease blood pressure. So that is the intended action, to decrease blood pressure. Now, side effects, that's another thing we have to concentrate on when we're dealing with meds. And every medication will have a side effect. There's not going to be a time where it does not. Every drug has a side effect. They are unwanted or unexpected results or conditions that come along with the desired effect of drugs. There can be minor changes, they're not intended. Sometimes they can be good, sometimes they aren't good. For example, narcotics, they're prescribed for pain, but side effects for them, they can cause nausea and they can cause constipation. Okay, does it mean that we stop the medication because they're having nausea or constipation? No, that is a common side effect that occurs with these medications. It's expected. It is one of those expected things that can happen. So what we do is we tell the patient if it causes nausea and or upset stomach, take it with food. We also tell them if it makes them constipated, increase their fiber, increase their water intake, and exercise more. Okay, so they are common things that occur, but it doesn't mean that we stop the medication for side effects. And that's the issue. A lot of times people confuse allergies, like allergic reactions, to side effects. So that's why it's very important to ask the patient, what happens? Why can't you take this medication? Another example would be anti-hypertensive medications. We know that it will decrease the blood pressure because that's the goal. It's going to lower the blood pressure, but it does have some side effects of dizziness, as well as it will lower your blood pressure. So a lot of times we have to teach the patients to sit on the side of the bed. Do not get up right away because we don't want them to pass out or faint, and to wait a little bit before they go. So that is a common side effect that can occur with these medications. Remember, all drugs have at least one intended action and at least one side effect. Okay, so to continue on, the doctor's goal is to prescribe drugs that will benefit the patient without causing a lot of side effects that can happen. That's our goal. We want them to, it can happen, the side effects can happen, but our goal is to prevent those from happening. Okay, so let's talk about drug names. Now, there's different drug names. We have the chemical name, and that is the one that is used by the chemists and the manufacturers of the drug. It's actually the chemical component of the drug. Now, what we are focused on is the generic name, and this is the drugs that you have to know. You have to know the generic name. That is what the board is looking for. That is what's going to be on your test, your board test. So generic name is now what they're looking for. The generic name is shorter than the chemical name. And usually a lot of times the endings can tell you what the drug classifications are. So for example, if it ends in OLOL, that's a beta blocker. Examples of that would be like atenolol and metoprolol, but they will actually give you clues on what the endings can be. These ones are not owned by any company. Anybody who makes drugs can use the name. This is the actual drug name. It will always be in lower cases, okay? But it's the actual drug name, and it's always in lower cases. For example, acetaminophen, that is the generic name, okay? It is a small a, but acetaminophen, and the brand name would be Tylenol, okay? And we're going to talk about the next. So the generic name is the actual drug name. It's in lower cases, and it's not owned by any company. Any drug manufacturer can make acetaminophen. Now, the brand name, on the other hand, that is created by a drug company. It's a specific brand, always starts with a capital letter, and it will always end with a certain symbol. So it could be R with a little circle, that just means registered trademark, or TM, which means trademark. It can have more than one name. That name is owned by a specific manufacturer. For example, we know the generic name is acetaminophen, and that's the actual drug name. No one owns that. But the brand name is Tylenol, and Tylenol is actually owned by the company itself. So, that's what they have to watch for. All right, so back to that. So generic name, lowercase, brand name, um, capital letter. It's owned by a manufacturer or company. And so we have to remember, so there's always going to be at least one chemical name, one generic name, which is in lowercase, but you can have more than one brand name, and that's in upper cases. It depends on what company owns it. For example, like I said, Tylenol is owned by Johnson and Johnson, so that's their company that made that, and so they put their own brand name on it. But acetaminophen is the generic name. All right. So next thing we're going to talk about is over-the-counter meds. Over-the-counter meds, or OTCs, are something that we have to worry about. They are weaker than, and they're supposed to be less harmful. We don't need a prescription for them. We can self-administer it without any doctor telling us to. It can be harmful if we don't follow directions, but it's important to ask the patient anytime we ask for their medical history. It is important to ask them, what other medications? Are you taking any over-the-counter drugs? They can be abused. A lot of people will abuse them. They can abuse vitamins. They can abuse aspirins, antacids, laxatives, etc. Some medications can be prescribed that are over the counters. If they are prescribed, that usually means that it's prescription strength, and it's going to be a little more stronger. So you can buy some topical like cortisone over the counter. It's going to be a smaller strength, but if you get a prescription strength, it's going to be a higher medication dose. Just like stomach medication. If you buy like Pepcid over the counter, it's going to be a smaller dose. If you get a prescription, it's going to be a higher dose. Some over-the-counter meds, they do not have prescription strengths. For example, aspirin does not come in a prescription strength. Tylenol doesn't, and Benadryl does not. Now, sometimes you will see doctors give a prescription for those because it just helps the patient pay for the medication with their insurance. But otherwise, if they can't afford to buy it over the counter, that's just helping them out a little bit. But it is not a prescription strength. Now, prescription drugs, on the other hand, these need prescriptions from the PCP. They can cause more harm than over-the-counter drugs. The strengths will be stronger. You can have more side effects. They can be very addictive. And it's not good for self-administration. It's only prescribed a certain amount for a certain amount of days. And it will be prescribed by the doctor, who will tell you how to take it and when not to take it. The next thing we're going to talk about is high alert drugs. High alert drugs, these are drugs that can cause major harm to individuals if they do not get them correctly. These meds always should be double checked by another person. A lot of them need dual sign-offs. That means 2 nurses need to sign the medication off before they give it to the patient. So there's actually a mnemonic that we go by, and you need to know this. It is PINCH, P-I-N-C-H. And they have certain medications that have they are very high alert drugs. They're the ones that can cause the major harm to an individual. The first one would be potassium. A potassium, if you give a lot of it, could kill a patient. The second one is insulin. Insulin, you have to be very cautious. You actually need 2 nurses to sign off insulin. The third one is narcotics or opioids, the N in PINCH. Opioids are very addictive, narcotics very addictive. A lot of times if you're going to waste narcotics, you need 2 nurses to sign them off. Many times if you're counting like at the end of the shift, the narcotic count, 2 nurses need to count to make sure that the count is correct. The C in PINCH is cancer or chemotherapy agents. They're very destructive on tissue and can kill someone. So that's another high risk medication. And the last is heparin. And heparin can cause a lot of issues with your blood. So that's another medication that needs 2 nurses to sign off before you give them. So that's your high alert drugs. So remember the mnemonic PINCH, and remember the 5 things that PINCH stands for and why it's very harmful. And it's very important to make sure individuals make sure they give the correct dose. Okay, next thing we're talking about is herbals. Now, we talked about asking the patient about over-the-counters. It's also very important to make sure we ask the patient about herbal products. These are natural products made by plants, made by plants, byproducts. They can change the body like prescription drugs do. They're also known as many different things: botanicals, herbals, homeopathic therapy, natural therapy, alternative therapy. People think they're safe, but they can interact with a lot of prescription drugs. That's why important we ask, are you on any herbal medications when we ask them about their medications? Because a lot of times people don't consider them prescriptions. They're not regulated, but they can cause harm if they're not used correctly. And always talk with your PCP or a pharmacist before starting any of these medications, because they can actually look at your meds and see if there's any way of their interactions, if they cause any problems and things like that. So that's something important to watch for. Now, there are a few people that we have to agencies that get credited when we deal with pharmacology or drugs. Now, the FDA, that is the Food and Drug Administration, these are the ones that enforce the drug standards of meds. The USP, which is the United States Pharmacopoeia, those are responsible for drugs overall. They deal with the manufacturers, they deal with how the drug is made, as well as the labeling of the drugs. Both determine if the drug is safe or not, so that's important. The DEA, which is the U.S. Drug Enforcement Administrator. Now, the DEA, those are the ones that make the drug laws. They're the ones that control substances. They watch with those. They're the ones that deal with illegal drugs. These are the ones that deal with those addictive drugs. Any PCP that can prescribe a controlled substance is always given a DEA number that they must put on that prescription. And we're going to talk about that more in Chapter 7. But every person, every PCP has to have a DEA number if they're going to order any type of narcotic or anything that is under the controlled substance label. So that's what we do have to watch for on that. I am going to stop the lecture momentarily, and then I will go with the second part in a little bit here. I will break this up a little bit so the lecture won't be too long and you guys can, at least do a little bit. So hold on a second. Let me